During this COVID-19 national emergency, I keep hearing complaints from politicians on the left and from the left-wing media that everybody needs to get tested. I think that it's not helping the situation. It's helping to spread the panic, and I think these people aren't they don't understand logistically what that entails. See, here's the thing. You've got to manufacture these tests. They take time to manufacture. If you rush it, you risk having defective tests. Now, I don't know if they have to test you twice to confirm you're positive. Say you come up positive, do they just say, all right, you're positive, quarantine? I know you have to test negative twice to get the all clear. Or at least that's the way it was explained on the news. So I guess I should take that for what it's worth. But the thing is, let's say you take your whole family down to one of these testing centers and they test you. And let's get rid of the 24 to 72 hour time it takes to send the stuff to the lab and get the results back. Let's just say they had an instant test. They could test you right there. All right, you're in the Walmart parking lot. You decide you're going to get your whole family tested. They test you. They say, nope, nobody has it. All right, well, since we're here, we should probably run into Walmart to get toilet paper. Now you're touching the door handle. Now you're touching the keypad on the self-checkout if you do that. Or you're touching who knows what your kids are touching. I was in Walmart 2 weeks ago, and there were 3 people in the store coughing. One of them looked like death warmed over. She was leaned over her cart. She looked awful, and she's pulling her coat in front of her face, and she is hacking so loud you can hear it anywhere in the store. The other 2 people, I didn't even round the corner to see where they were. I just moved away. So you could get tested. You could get told, assuming there were instant results. You don't have it. And then 5 minutes later, you could be exposed to it. For a lot of people, this is going to be letting it run its course. Most people are not going to be hooked up to a ventilator or put in a medically induced coma or anything else like that. I'm wondering if these overwhelmed hospitals truly have patients that are on death's door in there, or are they letting everybody in? I have gone to a doctor's office, I haven't gone to a hospital, and I haven't seen these testing centers at Walmart that they said would be out, but hey, whatever. I knew that promising they'd have it in a week was, it's going to happen, but it ain't going to happen that fast. But anyhow, I heard that they were checking people's temperature when they come to the door at the hospital, and if you don't have a temperature, they're not letting you in because you don't need a test. You don't need to be seen. But I don't know if that's true because I haven't verified it myself, and I'm not going to go down there. I'm only going to go down there if I have an emergency. It's going to be an absolute last resort because I'm more likely to catch it going down there than going anywhere else. So getting tested is not a cure. I think just like the people have misinterpreted, if you're under 60 and you don't have underlying health conditions, you're less likely to die, as being tested negative means you're immune or you're cured. And it's not that simple. That's what people want. They want instant, they want answers, and they're not getting it. But this whole thing about everybody needs to get tested, no, we don't. If we get sick, we're quarantining in the house. We're not letting anybody out, even if only one family member is showing symptoms. We're not going to go get tested, and we're going to let it run its course. We're going to stay hydrated, and we're going to let it run its course, and we're staying in the house for 14 days, period. It's as simple as that. Now, if one of us had a health condition, if one of us started having shortness of breath to the point where it wasn't that we felt weak or we couldn't move around, if we were just sitting there, laying there, and we were okay, then that's okay. Let's just deal with it. But if one of us was really, we thought somebody was going to die, at that point I'm calling an ambulance or something. But, that's just common sense. And a lot of people just don't have common sense. I'm not a doctor. I'm not in the medical field. But I do have some common sense. And getting out there and either exposing everybody to it or trying to get this false sense of security, that doesn't make any sense. So I'm not all about this. Everybody has to be tested. I hope at some point they've got a simple, quick test that can be administered at any doctor's office and that it's available in the future. But I know these things take time. We got to be patient. Thanks for watching.